was teaching us felt it was important to learn about Black history. So for the past couple of years, Betty had showed us films and discussion on Black history. And for some people, it was enlightening. For me, quite not so much. I come from a multiracial family.
Mm-hmm.
So for me, I know some history. But Betty still taught me a lot.
Mm-hmm.
And we felt it was important to continue in her legacy and her honor. And Patty Ryan was one of our members with the Women's Caucus, who said, let's continue this, let's do this. And she found the film Power to Heal. And myself being a nurse and a health practitioner, I was amazed, and I knew some of the history, but not all the history, about how the disparities of healthcare and how we became integrated in the hospitals.
Mm-hmm. And I think a lot, where were you born and raised?
New York City.
New York. I'm from Pennsylvania. And how about you, Penny?
Oh, I was born in suburban Denver. I was born into a family. My mother was a grassroots social worker. She was a community organizer. My dad was a salesman.
Yeah.
And so we grew up, marching for human rights, for social rights.
Mm-hmm. So we're all Northerners.
We're
Yes.
all
Northerners.
Yes,
and
of course.
that's where it is much different and very different when you grow up in Northern America, I feel, rather than Southern America. There's just differences that you may not have seen or heard about or been part of your youth or childhood, depending on where you grew up, the families, and so on. And like you said, maybe a little bit more depending on your families and involvement with social issues and other things like that, or the makeup of your family as well.
Mm-hmm.
But I think it was, and for me, it's kind of easy to be shielded or maybe not exposed to some of those things because of where you grew up and kind of your youth. So it's good to hear about history, the history of the country, and kind of what happened and the different struggles throughout our history.
I think it is important, and I think, although it was primarily in the South
Mm-hmm.
that we think about it, when we think about
Mm-hmm.
segregation, it took place in Chicago as well.
Mm-hmm.
I mean, it was also in the North. All the hospitals were segregated
Mm-hmm.
throughout the country,
Mm-hmm.
even in the West, which we don't think about
Yeah.
because we were isolated.
Mm-hmm.
And that's something that we think is important to know. I've talked to different healthcare people about the film, and they said, really?
Mm-hmm.
And younger people who
Mhm.
just are not aware. So we really feel this history is important.
Mm-hmm. It is. It
But
really
up
is.
until LBJ,
Uh-huh.
there was a policy for healthcare that was separate but equal. It was very separate, but it was never equal.
Mm-hmm.
And up until the Medicare bill passed and the requirement for hospitals to require Medicare funds, they had to desegregate Black healthcare. So up until that time, and that's the early 1960s,
Mm-hmm. Mm-hmm.
Black individuals throughout the country, it was not just in the South, they were
Everywhere.
not admitted to
Wow.
emergency rooms. They died in ambulances because ambulances were not allowed to take them to white hospitals. They had to go to Black hospitals. There was a dearth of Black practitioners.
Mm-hmm.
And the movie, when I watched the movie, I was shocked. I knew that it was bad, and I knew that Jim Crow segregation had continued,
Mm-hmm.
but I had no idea what the disparity was.
Mm-hmm.
And then when we started doing research, that awareness
Mm-hmm.
of how that disparity continues now.
Yeah, I was watching the trailer for the movie, and there was a Black pediatrician that was speaking on or sharing his experience, and said he was saying that he was the only pediatrician in the entire state.
Right.
And I didn't catch, or I don't know if they mentioned just in the clip what state that was, but I thought, in the 60s, for the entire state to have one pediatrician to serve that community, the Black community, is crazy.
It was crazy.
So, and I'm sure there's more examples of that we're just not aware of, we never knew about, and never were exposed to.
And Black physicians did not have access to hospitals.
Mm.
They weren't allowed. The American Medical Association
Mm-hmm.
would not allow Black physicians to have access to the hospitals.
Mm-hmm.
So they had, if they didn't have their own hospitals, then they had nowhere to take their patients.
Mm-hmm.
So they did a lot of home care
Mm-hmm.
that people didn't do at that time.
Mm-hmm.
And so this film shows this.
Mm-hmm.
And the film was put out by the National Humanities not the arts, National Endowment for the Humanities,
Gotcha.
and the City College, University of New York.
Mm-hmm.
So it was produced by a really strong group.
Mm-hmm. And it's narrated by Danny Glover.
Danny Glover really does a
it-
good job.
Yeah, and it's a hour-long documentary. Again, this is going to be shown Tuesday, February 1st at Messinger Funeral Home at 6 p.m. with discussion to follow. And this event is open to the entire community. So
Most certainly.
yeah, it would be great for people to come out that want to learn more about this and see firsthand and hear from doctors and others that dealt with this and were parts of that civil rights movement to change this and to get that changed. So were you going to also, I think, announce about your office? Did you have that
Yes,
information?
yes.
Okay.
Yeah, the
Yeah.
Democratic headquarters will
Yeah.
be opening of our grand opening February 14th.
Okay.
And I do not have the exact address, but I can tell you exactly where to find it. We are right next to Payston Postal.
To Payson Packaging.
Payson Packages,
Payson
thank you.
Packaging and the little vape shop, and it's just behind the Buffalo
Buffalo
Bar.
Bar,
Exactly.
right on Benita
Yeah.
and 87.
And that is Valentine's Day.
Yeah.
Grand
Yeah.
opening, yeah,
What a great
February
time to open up.
14th.
Yeah.
Right there. And again, you'll get the address of the building, and just off the top of our head, we didn't remember the address there, but it is the building that has Payson Packaging in it, and also a vape shop, and then there's an empty suite right there, and that's where the Democratic headquarters are.
Mhm.
All right. And
Yeah,
that's
we're excited to have it.
yeah, and that is February 14th. Just wanted to get that out there, but also if there was other information and stats you wanted to share on
Well, yeah, I
this
think
film.
one of the reasons why we celebrate Black History Month is to be able to understand, where folks have come from and
Mhm.
where we are now, and then where we can move forward to
Mhm.
create change. And so, every Black History Month has a theme, and this year the theme is Black Health and Wellness, which is
Mhm.
why we chose The Power to Heal for the movie.
Mhm.
And this theme this month explores the legacy of not only Black scholars and medical practitioners in Western medicine, but also the ways that they had to create other ways of knowing within the wake of that disparity of traditional medical services. So really honoring birth workers and doulas and midwives and naturopaths and herbalists in ways that the Black community was forced to come together in alternative medical practices, and the way that they're expanding that now, which is very exciting to me.
Mhm. Mhm.
Yeah, and then another piece that was really prominent when I was, researching and just doing my own thinking about what Black History Month means to me is that, we all know that the American health system is troubled.
Mhm.
It's not. We're all suffering with an inadequate healthcare system, and it remains beset with inequities that have had a disproportionate effect on people of color and other marginalized groups. So these have, created huge gaps in health insurance coverage and access to service, and poor health outcomes in certain populations. And Black Americans are at the bottom of that healthcare barrel.
Mhm. Mhm. Yes, which it needs to change. I
It
mean, it
needs
shouldn't
to
be like that
change.
for anybody based on skin color, based on economic status.
Where
It
you
just
live, your
where you-
gender, your educational level.
Yeah, and that is something that I think it's been like that for a very long time, and is still there to
It's still
certain
there.
extents in different places, and you have to wonder why. Why? I know we were just talking about it with my wife and I, and a friend. Women's rights, the same way, where you look at 60, 70, 80 years ago, 100 years ago, and if they, people that fought, and, for women's rights, and they look today and kind of saw where we were, I would have to say they'd be a little disappointed.
I think they'd be really disappointed.
Marie kind of like, a little, are you serious, Chris? Where yeah, it's, yeah.
We're moving forward with all social justice and inequity and just basic human rights, but yet we have so far to go. And I think when we said, even though we have, we don't have great access to health care and the system is kind of breaking down, but so many of us have so much privilege.
Mm-hmm.
And to recognize that privilege, for me, that's how I was raised.
Mm-hmm.
I was raised in an upper middle white family, upper
Mm-hmm.
middle class white family in the suburbs of Denver.
Mm-hmm.
And my parents always raised me recognizing that I had a huge amount of privilege, and it was my, not my right, but my responsibility to recognize that,
Mm-hmm.
and to do whatever I could to understand and then to work with rectifying those social injustices.
Mm-hmm.
This has been a really lifelong path for me.
Mm-hmm. Yeah, I think also recognizing and understanding, and there's, I think, different privileges, and just in our country, I think being blessed in so many ways,
Yes.
and looking outside of our country and realizing how many people, and the majority of people around the world, don't have access to the same things we have access to. But then in our country, unfortunately, it's been, it isn't equal access to everything for all Americans.
Exactly.
And that's where I think, people coming together to try and rectify that and to fix that and to bring more equality here in the U.S., knowing that we do have access to things, healthcare, and we should have access and the best healthcare, and really the best of a lot of things in this country, and it provided to everyone on an equal plane.
And it's important to remember the history.
Mm-hmm.
Like you mentioned about with the women's rights. Well, it's important to remember the history about Black rights too, and why we are at the point we're at now, and why people are asking for change because of what has occurred in the past, and why some people are so reluctant to get health care because of some of the disparities that went on in the past, and some of the things that were done to people of color, not only Black people, people of color, throughout our nation. So this is something, I want to read a quote from Bishop Desmond Tutu.
Oh, that's amazing.
And one of the things that he said that I think is really pertinent for us right now, the pathway to racial reconciliation after periods of social injustice like those in South Africa and the United States should be not to forget these events, but to forgive and remember them through documentation and open discussion by all sides. And that's what we're trying to do. We want to have open discussion. What was your history? What do you know about this? Where do you feel you have a place in promoting social justice and preventing discrimination throughout? My history is, as I said, is a little different. I come from a multiracial family. I have in my family, we have Black, Jewish, Chinese, Korean, Hispanic, cousins and uncles and children.
Yeah.
My own children. So I'm familiar with a lot of things and discuss some of these issues with some of my nieces who are and I've been in healthcare for many years.
Yeah.
With students of color, and saw what they faced when they took care of patients in our Western hospitals, some elderly white patients, and what discrimination they faced. And I had to work with them to accept some of the understand what some of the older people. This is many years ago in the 70s, what their attitude was and why they had that attitude. So I come from a little bit different perspective, and with Betty, I just love Betty, and we were good friends, and I feel like Penny does, that we want to honor her. She felt it was important to continue the discussion and to continue working together, and that's one of the reasons we're continuing in her honor.
You have a great example of a lot of diversity there in your
Yes.
family.
Yes.
Oh my
Yes.
goodness.
And it's been fascinating. I love it. And coming from New York and my history, my mother we weren't activists,
Uh-huh.
but my dad was a strong union person.
Uh-huh.
And so I learned about that,
Yeah.
about unions and working together.
Mm-hmm.
And Mom always went to all the local meetings of all the community events.
Mm-hmm.
You know, and she wanted to know who was going to be the controller in the city and things like that. So she was aware of those kinds of things
Mm-hmm.
in our community. And my community itself was quite diverse, coming from New York City.
Mm-hmm.
So it's interesting, our history, and looking, Penny and I and Patty talked about this. Anyway, we feel that it's something important. The film, I've watched it a couple of times, and it's a strong history. And since it was promoted by the National Endowment for the Humanities, we feel like it's not one side or the other. It states the facts and it gives a lot of history footage, interesting footage of LBJ and how he got this across. You'll laugh at some of the ways that he worked with the American Medical Association and other groups to get this get hospitals desegregated.
And the way he worked with people on all sides. I mean, it was a common belief that, and it was a shared belief, post-civil rights movement, that we had to move forward with this. And my respect for LBJ after watching this movie is just phenomenal. I mean, he took on the AMA, which are all these white men who were saying, we aren't going to do this. And I don't want to get the stats wrong because I remember feelings and passion, but I'm not good about remembering stats. But there was a statistic, like they were asking one of the AMA members, how much money have you spent with lobbyists to keep this from happening, to maintain segregation within healthcare? And it was like $6 million in the early 60s.
In the early 60s.
That was like a fortune to prevent this from happening, and it's very dramatic. It happens at the very last minute. We don't know if the bill's going to pass. Phone calls are being made, and it's all real footage.
Oh, wow.
So it's historical footage that is really, really moving. So,
wow.
And then to think about what's happening now, and so, I come from that really passionate, emotional side of me that says, can I just share some of these stats? Because they were really overpowering to me. And it's, again, these are from Amelia Taylor from the Racism, Inequity, and Healthcare for African American Society. And it's of more than the 20 million people who have gained coverage under ACA, 2.8 million of them are African American, yet this population is still highly more likely to be uninsured than white Americans. The average American family spends 11% of household income on healthcare premiums and out-of-pocket costs, which we know is a lot. But that amount approaches 20% for African American households. Because African Americans tend to be poorer than other demographic groups on average, public health insurance programs such as Medicaid are vital to ensure affordable health care and healthier outcomes. Yet right now, 14 states in our country have resisted Medicaid expansion. And this is primarily in the South. And this stat, because maternal mortality and working with women and children has always been a passion of mine, is that with even improved access to Medicare care under the ACA, the disparities in healthcare outcomes for African Americans and white are stark. African American women are 3 times more likely to die of pregnancy-related causes than white women, and the African American infant mortality rate is twice that of white infants. How is that still happening in 2022?
In our country.
In our country. This is not other world countries.
Right. This is
in our country.
In our country, and I know before the program we talked, and you mentioned, Marie, that our infant mortality rate, where it ranks globally, is not good. I mean, it's very low for first world countries.
We have the highest maternal mortality rate of any developed country. Still, across the board.
And so we have that, and that's a problem. And then it goes even further with the stats you shared, to where it's that inequality in our country. That, okay, it's bad, but it shouldn't be even worse for one group.
Yeah.
It just, that's, yeah, there needs to be, some accountability there and some
Most
change, I feel.
certainly.
Yeah.
Most certainly.
And again, this will be brought out, and you could learn more about this, you can learn more about this, in a documentary that's being shown at Messinger Funeral Home, 6 p.m. on Tuesday, February 1st, and it is called The Power to Heal. And this is in recognition of Black History Month, narrated by Danny Glover. And as you said, Maria, just as a documentary showing kind of facts and giving examples from people that were there, that have gone through this, that
Yes.
were a part of this, and the that movement in that time, during that time, to get this changed.
The footage is amazing,
Mm-hmm.
the footage that you see. And I just want to say, people also will make sure we have CDC guidelines during the filming.
Mm-hmm.
It's one of the reasons we asked messengers, because it's such a big hall.
Mm-hmm.
And there's plenty of room for people to spread out. And they've been very kind to allow us to have the films there every year.
Okay.
And we want to thank them.
And now, is this going to be in the main, like the sanctuary
Yes.
area where you have
The
the
main
big screens?
sanctuary
Yes.
area, right?
And okay, oh, that's, yeah, there's
Yeah.
a lot of room in
Lot of
there,
room.
so that is great.
Yeah, and we want to thank them for allowing us to do this.
Yeah, they've been wonderful. Last week, the Democratic Women Caucus sponsored a really wonderful film on voter rights
Mm-hmm.
and voter rights suppression. And again, just looking at what the stats were,
Mm-hmm.
this is the truth about what's happening in our country, and a group of folks coming together to try and work towards leveling the playing field.
Mm-hmm.
I think that's one of our, real interests within the Democratic Women's Caucus, is to just get information out. We've been together for 5 years now,
Mm-hmm.
and we've done countless many kind of gatherings and events, and the mission behind that is to bring people together to have an open communication, because I believe that although that we're very, very fractured in our country right now, and within Payson for sure, but we are more similar than we are different.
Mm-hmm.
We believe more than we disagree.
Mm-hmm.
And we feel that healthcare, I think most people feel healthcare is important,
Mm-hmm.
and that it's an important issue.
Mm-hmm.
It's universal.
Mhm.
It
Oh,
is
yeah.
definitely universal.
Mm, it is. Again, that movie documentary is The Power to Heal, and it's being shown Tuesday, February 1st at Messinger Funeral Home at 6 p.m. with discussion to follow afterwards. And this event is open to the entire community. There's plenty of room in the sanctuary there at Messinger Funeral Home, so you can spread out and have that distance from each other. So you're encouraged and invited to this showing.
Just come.
Yeah, come out. And thank you so much. It's 10:30. That goes
Hey, the
like
guys so
that.
fast.
I know, it goes so fast. But thank you so much to Marie Fasano and to Penny Navis Schmidt for coming on our Community Spotlight program today. And thank you everyone for listening and also watching on our KRIM Facebook page and YouTube channel. Let's get back to the music with some Rolling Stones, Leonard Skinner, Joe Cocker, and more. But first, it's time for the weather from the National Weather Service.
Wow, that was fast.
That went really fast.
That
If you do a little peek